Tuberculosis is an infective disease caused by Mycobacterium tuberculosis. Recent figures suggest a decline in the incidence of TB, but its impact on the world remains significant. India is the highest TB burden country in the world in terms of absolute number of incident cases. Many individuals are infected asymptomatically with tuberculosis. It can affect various organ systems in the body, the most common being pulmonary tuberculosis, which affects the lungs. It is important to properly diagnose all the cases of tuberculosis. Persistent cough and fever for more than 2 weeks at a stretch is an important case-finding tool along with sputum and X-ray studies. Newer investigations have come forth. The drugs available are highly effective and are used in combination. Many newer drugs are on trial.
ওয়ার্ল্ড টিবি ডে অর্থাৎ কিনা বিশ্ব যক্ষ্মা দিবস আপনারা হয়তো অবগত আছেন, এটা প্রতি বছর 24শে মার্চ অর্থাৎ 24 মার্চ পালিত হয়। ওয়ার্ল্ড হেলথ অর্গানাইজেশন অর্থাৎ কিনা WHO এই বিশ্ব যক্ষ্মা দিবসটা পালন করে মূলত যক্ষ্মা সম্বন্ধে মানুষের সচেতনতা বাড়ানোর জন্য। আপনারা হয়তো অনেকেই জানবেন যে আজকে বিশ্বে যক্ষ্মা হচ্ছে সবথেকে বেশি সংক্রামিত অসুখ এবং বিশ্বের যত যক্ষ্মার পেশেন্ট আছে, যত যক্ষ্মার রোগী আছে, তার সর্বাধিক পেশেন্ট কিন্তু আমাদের দেশে অর্থাৎ কিনা ভারতবর্ষে। কাজেই ভারতবর্ষে যক্ষ্মার রোগীর সংখ্যা সবথেকে বেশি। যক্ষ্মা সম্বন্ধে আপনারা কিভাবে সতর্ক হবেন? নিজের বা নিজের পরিবারের বা আপনার আশেপাশের লোকজনের যদি 2 সপ্তাহের বেশি কাশি এবং জ্বর থাকে, কাশি অথবা জ্বর 2 সপ্তাহের বেশি থাকে, তাহলে সরাসরি নিকটবর্তী সরকারি স্বাস্থ্যকেন্দ্র অথবা সরকারি হাসপাতালে গিয়ে কফ পরীক্ষা করা। এটা খুবই সহজ পদ্ধতি এবং সরকারি মাধ্যমে সম্পূর্ণ বিনামূল্যে কফ পরীক্ষা হয়। কফ পরীক্ষার মাধ্যমে প্রাথমিক স্ক্রিনিং যাকে বলে, এই স্ক্রিনিংটা করা যাবে। পরবর্তীকালে কফ পরীক্ষার রিপোর্ট অর্থাৎ যদি পজিটিভ আসে, তখন যক্ষ্মা রোগের ট্রিটমেন্ট বা যক্ষ্মা রোগের চিকিৎসা চালু হবে। ডটস পদ্ধতির মাধ্যমে পেশেন্ট নিজে স্বাস্থ্যকর্মীর সামনে ওষুধ খাবে এবং ডটস পদ্ধতির মাধ্যমে যক্ষ্মা রোগ কিন্তু সম্পূর্ণভাবে নিরাময় হয়ে যায় যদি রোগী ঠিকমতো ওষুধ খায়। কাজে এই সচেতনতাটা খুব জরুরি। 2 সপ্তাহের বেশি কাশি এবং তার সাথে জ্বর থাকলে নিকটবর্তী স্বাস্থ্যকেন্দ্রে গিয়ে থুতু পরীক্ষা করা এবং যদি পরবর্তীকালে যক্ষ্মা ধরা পড়ে তাহলে ডটস পদ্ধতির মাধ্যমে সরকারিভাবে সম্পূর্ণ বিনামূল্যে চিকিৎসা করলে যক্ষ্মা সম্পূর্ণভাবে সেরে যাবে। আজকে বিশ্ব যক্ষ্মা দিবসে সাধারণ মানুষের প্রতি এটা আমাদের ডাক্তারদের একটা বার্তা।
There are problems like acquired drug resistance, malnutrition, overcrowding, indoor pollution, tobacco smoking, alcohol abuse, and these problems make the populations more vulnerable to TB. TB is a preventable and curable disease.
The control and treatment of tuberculosis was a problem since time immemorial, and till 1960s it was basically dependent on the physician's own acumen of diagnosing tuberculosis, and they depended mostly on the X-ray findings of the patients who were coming to them with a symptomatology that they thought was of tuberculosis. And naturally the diagnosis as well as the treatment regime both were dependent on the physician himself as he thought deemed fit for that particular case. And what that actually meant was different people was given different types of drugs, as well as the nature of diagnosing tuberculosis was a bit difficult, and at times it differed from one physician to another physician because the interpretation of X-rays are always dubious. Now that actually had resulted in different types of outcomes of the disease, and 1962 from 1992 we had faced that problem, and in 1992 we first thought that thought that there has to be some method in diagnosing the disease, as well as some agreed upon principle to actually treat those cases, and therefrom revised tuberculosis control program came, and the treatment actually changed into DOTS, that means directly observed treatment short course, where the physicians had to actually follow some guideline given by the central government, and to stick to that guideline, the protocol for diagnosis of the treatment, and as well as the nature of the drugs that should be given to them. Now the thing is that at that time, basically our aim was to find out those cases who were open cases, meant the cases in which tuberculosis bacilli were being thrown into the air by aerosol routes, because there was the priority cases in those days that for the community point of view, those cases were the cases where from TB were being spread. So the idea was that if we can control those patients, in that case we may actually come to see the end of tuberculosis. So we thought that at least if we can achieve 80% of cure, 85% of cure of those cases who are actually spreading tuberculosis through their sputum, it was the treatment was actually initiated for them. Now we had actually achieved that target, and in most parts of India we have achieved 85% of cure rate. Now the problem that plagues us at the present moment is that what about the rest of the people who we could not detect simply by sputum examination or simply by other types, and thereupon we thought that we have to take into account the other types of diagnostic procedures by which we can actually get hold of those cases who are probably not shedding the tuberculosis but are actually suffering from the disease. That is why nowadays we have adopted two more additional strategies to include more and more TB cases. Naturally, we are introducing two more types of diagnostic procedure. One is by culture, the other is by CBNAT, another microbiological test, by which we can actually include more cases who probably are suffering from tuberculosis, and to give a drug not merely on a thrice weekly regime but on a daily regime, to increase the number of cure for the patients, because we all know that the outcome of a drug taken every day is probably better than that outcome taken if the drug is taken every second day, means one day alternatively. So this is how we actually change from one phase to another. Our first idea was to catch hold of those patients who were suffering from the disease and to give them a standardized treatment. And when we have achieved that goal, now we are aiming for those patients whom we might have left out or have missed because of this particular protocol, and then trying to get rid of the disease in their case as well. That is why we have changed the protocol, and the newer regimes of tuberculosis has come, and hopefully we'll be able to catch up with the WHO goals of NTB strategy. Thank you.
The theme of World TB Day 2018 is Wanted Leaders for a TB-Free World. It aims at building commitment to end TB. All stratas of health system, community as well as political support will be required for the same. Revised National Tuberculosis Control Program has been functioning in India for years to achieve the end of TB. It has undergone various modifications. On World TB Day, many doctors and health workers from Malda Medical College and Hospital contributed in the mission to end TB by spreading awareness and holding campaigns all around the city of Malda. 53 million lives were saved through effective diagnosis and treatment in between the years 2000 and 2016. While many questions remain unanswered and with so many trials online, let us move towards a TB-free world. Let us spread the awareness and do our part in achieving this dream.